So, I mean, following on from my thoughts on basically need to be careful when drinking and taking antidepressants. What's your view on the impacts of heavy drinking and taking antidepressants?
Well, the whole interplay between heavy drinking, heavy drug use, and any other mind-altering chemical, including antidepressants, is clearly it's a minefield. Obviously, in the recovery world and the 12-step rooms, people there quite rightly say they're not doctors. They aren't there to give medical advice, quite rightly. And if somebody has a legitimate psychiatric or psychological diagnosis for a condition such as depression and anxiety, and they receive the right medication, then so be it. However, if you then start to drink as well, and then you drink to the level of being dependent or alcoholic.
For men, maybe around 100 units a week ish. Or getting up there, really.
Yeah. So if you once you stray into that territory, that the heavy end, and teetering towards full blown addiction, and you're using medication as well. Well, then from our perspective, you have a dual diagnosis or a comorbid condition.
Yeah.
So you now have a psychiatric condition for which you were prescribed medication, for example, antidepressants, but you've now developed a substance misuse disorder, and untangling the two is very, very difficult. So that's why abstinence is crucial, if only for a period. You've got to take the alcohol and the drugs and the illicit drugs. Let's just stick with alcohol. Take the alcohol out of the picture. If I'm depressed and anxious, and I'm self-medicating my anxiety and depression with alcohol, and then I take the alcohol out before I get the medication. If I take the alcohol out of the picture, and suddenly, after a week, after two, after being detoxified, the world seems a bit of a friendlier place. Maybe the reason why I was depressed is because I was using a depressant drug.